Now, why is it important that this issue needs to be addressed and treated? It's because people who have reflux untreated for years together or decades together are at an increased risk of developing cancer of the foot pipe, cancer of the lower end of the foot pipe. Foot pipe in medical terminology is called esophagus. So esophagus can also develop cancers like any other part of the gastrointestinal system. Broadly speaking, there are two types of cancers in the esophagus. One is a squamous cell carcinoma, the other is a adenocarcinoma. Squamous cell carcinoma occurs mainly in the upper third of the esophagus and the middle third of the esophagus. Adenocarcinoma usually occurs in the lower third of the esophagus and at the esophagogastric junction, which is the junction of the esophagus and the stomach. Unfortunately, the incidence of this adenocarcinoma has gone up quite significantly worldwide as well as in India in the last 25 to 30 years. And the main risk factor that has been implicated in this increased incidence of junctional adenocarcinomas or lower esophageal adenocarcinomas is the reflux, the patients who live with reflux, untreated reflux. So it is quite important that if you are one of those who has been suffering from reflux for years together, sometimes on medications, sometimes off medications, and you develop certain warning signs, which I will enumerate in a little while, you seek medical attention immediately, you get an upper GI endoscopy and have proper guidance and proper treatment. Now, what are these warning signs? Now, if you have reflux for a long period of time and one fine morning you wake up with difficulty in swallowing, we call it dysphagia. So difficulty in swallowing, or you have been losing weight for no good reason. You've been eating okay, but still you've been losing weight. Or if you've been found to be anemic on just a routine blood test that you may have had done, you should be concerned. You should be concerned and you should have your reflux further evaluated. Not to say that all of these are indicators of cancer all the time, but then if you develop dysphagia, it may be an indication that the part of the lower end of the esophagus, which has been constantly affected by this chronic reflux, has developed a growth or a cancer, and that's causing blockage of food and water down. So it needs immediate attention, it needs immediate treatment. There are other reasons also why dysphagia can occur. Sometimes you could develop a benign stricture because of constant reflux, but it's always important to rule out the worst case scenario.